I am, upset that it, of course, took a global apocalypse to have things, put into, I think, even more of a of a spotlight than it was in the last few years. But I am also glad it does feel like the necessity and how critical it is to our general health and well-being uh, was long overdue, and I am so happy and grateful for that. The specialty of psychiatry within medicine too was always one that was relegated to people who were either very, very passionate about it, or for some reason and I think it was always a myth, but it was for people who couldn't get into anything else. And oddly, in the last 5 or so years, that has really turned on its head. And so it's one of now the more competitive specialties to try to match in, which is both great and wonderful and inspiring, but also we need so many of them. And so I think the expansion of training and everything within psychology, master's level clinicians, and psychiatrists, I think really needs to be a priority. Um, we did see a lot of devastation during, these years of isolation and these years of unknown what's going to happen in the future. And so, but I think for most of us, it really redoubled our efforts toward how do we get the message out there and how do we make sure that, this trend continues and expands.